Assalamualaikum and a very good day. My name is Dr. Siti Khadija from Pontian and I will be presenting our QA study titled To Eliminate Stigma and Discrimination Towards People Living with HIV Among Healthcare Workers at Klinik Kesihatan Pontian. This is our group members. We name our group One the Women and we consist of our FMS, Dr. Adila Aidil, Dr. Shuhaiza, Dr. Emmy, myself, Matron Rahizan, and Staff Nurse Rosanna, and our District Health Officer is Dr. Surina. So before we go to our study, a bit of introduction. According to Malaysia Global AIDS Reporting in 2020, our country has only achieved 56% of PLHIV receiving treatment after knowing their status. This is partly due to a very high level of stigma and discrimination towards them, especially in our healthcare setting. Even in Pontian itself this year, about 40% of our PLHIV has defaulted and refused our treatment only for this year. So that is why we are presenting this QA in line with quality improvement program initiated by the Health Ministry since middle of last year. So these are the 8 indicators of HIV-related stigma and discrimination for healthcare workers. There are 4 domains. The first one being fear of contracting HIV in the workplace. Indicator is taking blood from PLHIV, avoiding physical contact, wearing double gloves. The second indicator, the second domain, awareness of S&D, is indicated by healthcare provider unwilling to care for PLHIV or suspected PLHIV. Healthcare providers provide poorer quality of care to PLHIV as compared to other non-PLHIV. For the third domain, there are standardized protocols in the health facility that reduce the risk of becoming infected with HIV. And the second indicator is health facility has written guidelines to protect PLHIV from discrimination. And the last domain, for attitudes towards PLHIV, it is indicated by women living with HIV should be allowed to get pregnant if they wish. So based on a recent survey in Pontian in October 2021, with a sample size of 120, we found out that all healthcare workers, be it professional or clinical support staff, have at least one stigmatizing attitude. For the first domain, we have noticed that more than 80% of the staff are worried of taking blood from PLHIV and are practicing double gloves. This is a survey result for the second and third domain. For the second domain, we can see a high awareness level of S&D amongst the staff, as illustrated by the very low percentage of staff that are unwilling to treat PLHIV and the staffs who provide poorer quality of care to the PLHIV. For the third domain, we can see only 76% of the staff think that there is a written guideline on HIV-related S&D at the healthcare setting. For the fourth domain, we can see a very high percentage of healthcare workers having stigma in a sense that 70% of them think that women with HIV should not be allowed to get pregnant. These are the 8 main indicators for PLHIV. The first one being information about health is not explained clearly. Number 2, clinic environment is not welcoming and friendly. Number 3, PLHIV is treated without respect during clinic visit. Number 4, there is no privacy and confidentiality observed during clinic visit. Number 5, experience discrimination from healthcare provider or other staff member. Number 6, PLHIV is not involved in decision-making about care and treatment. Number 7, doctor is not spending enough time during clinic visit. While lastly, paramedic is not spending enough time during clinic visit. So the survey conducted on PLHIV to get input on S&D with a sample size of 10 found out that 8% of the PLHIV reported that they were treated without respect during clinic visit, while 8% of them reported no privacy and confidentiality during clinic visit, whereas there is a 42% of them reporting that they are not involved in decision-making about care and treatment. So from the survey conducted, we have identified two main problems, which is number one, healthcare workers worried of taking blood from PNHIV, while the second one is healthcare workers put on double gloves during procedure with PLHIV. So using the SMART criteria, which is the seriousness, measurable, appropriateness, remediable, and timeliness, our group members have voted the highest marks on the first problem, which is healthcare worker is worried of taking blood from PLHIV. Therefore, we have decided for the problem to be studied is about high percentage of stigma and discrimination towards PLHIV among healthcare workers during blood-taking procedure in KK Pontian. The reason for selection is because there is a very high incidence of KK Pontian healthcare workers having fear of contracting HIV during blood taking. This is serious because S&D in healthcare setting will negatively impact HIV treatment cascade as illustrated in the 2020 Malaysia HIV/AIDS Progress Report. Our study data is measurable based on feedback from the survey questionnaire. Our study is appropriate since stigma and discrimination among healthcare workers can impair PLHIV access to treatment. It is realistic in a sense that with proper training and education with latest guideline and strengthening positive outlook towards PLHIV via promotional activities will cause the healthcare worker to be able to deliver healthcare services without fear of contracting HIV during working. Our study can be conducted and completed within recommended time frame. However, there is no similar study on the process being done in KK Pontian. This is our literature review. The first one is a study done by Harapan H et al. In 2013 that demonstrated that PLHIV access to healthcare services are being denied due to the stigma in healthcare facilities. Second study done by Dong X et al. In 2018 in China demonstrated that 77.7% of the healthcare workers display stigma towards PLHIV. While the last study done by Geibel S et al. In 2017 demonstrated that healthcare staffs were seen to demonstrate significant positive improvement in attitudes towards high-risk behavior group of people after they were given stigma reduction training program on HIV. These are the terms and definition of our study. The first one is stigma is defined as irrational or negative attitudes, behaviors, and judgments driven by fear. Discrimination is defined as unfair treatment, laws, and policies, while healthcare worker is defined as one who delivers care and services to the sick and ailing, either directly as doctors and nurses or indirectly as aides, helpers, lab technicians, or even medical waste handlers. This is our problem analysis using the 5W and 1H, using what, where, when, who, why, and how. A bit of introduction to our problem statement. In Klinik Kesihatan Pontian, our healthcare workers involved in blood-taking procedure of PLHIV need to execute the procedure at least twice a year to ensure PLHIV treatment care and health are optimal. The patient is given an appointment for the blood investigation using a pre-filled form. On the blood-taking day, the staff will identify the HIV patient via the pre-filled biohazard labeled form. Average blood-taking procedure for all patients in KK Pontian is about 90 patients per day, and there are 2 staffs assigned in the procedure room during the day. In KK Pontian, HIV patients registered under the KK this year, there is a total of 65 patients. However, there is only 60% active cases, while the rest has refused and defaulted follow-up. Coming on to our problem statement. So the problem is high percentage of S&D among healthcare workers during blood taking, and this in turn causing PLHIV to default appointment, thereby affecting poor linkage to PLHIV treatment cascade. And the possible causes are lack of staff management involvement, lack of knowledge and awareness related to HIV, lack of reminder and education on the S&D. And our aim of study is to eliminate S&D among healthcare workers towards PLHIV during blood-taking procedure in KK Pontian. This is our problem analysis chart, consisting of 5 main factors that contributed to a high percentage of S&D towards PLHIV during blood taking. The first one being poor communication skill, second one, poor knowledge and awareness, third one, improper practice among staff, fourth, religious and cultural biasness, and the fifth one is ineffective SOP and protocol. So from the 5 main factors, we have identified only 3 main factors that we can possibly intervene, which are poor knowledge and awareness, improper practice among staff, and ineffective SOP and protocol. This is our study objective. The general objective is to eliminate stigma and discrimination among healthcare workers towards PLHIV during blood taking. Our specific objective is to identify the prevalence of healthcare workers who have stigma and discrimination towards PLHIV during blood taking, to identify contributing factors to high percentage of S&D among healthcare workers during blood taking, to formulate and implement remedial actions to reduce S&D among healthcare workers, and to evaluate the effectiveness of remedial actions in reducing S&D among healthcare workers. Key measures for improvement. Okay, so this is the process of care for blood taking for PLHIV. The patient arrives at clinic, and then at the triage, the staff there will triage the patient based on the appointment schedule, and the patient will be given queue number to the procedure room by the MA or staff nurse. They will then proceed to registration counter for them to register the details. This is done by registration counter staff. And lastly, they will go to the procedure room in which the staff will verify the blood investigation forms and prepare the specimen label. This is done by MO, MA or staff nurse. For our model of good care, we aim to achieve 100% standard for the entire blood taking process by means of no identifiable label on the queue number slip, no unnecessary protection such as wearing gloves, no specific label on the form such as biohazard, HIV or RVD, putting on single gloves for the procedure, and avoiding preventive actions and excessive decontamination and sanitation over the blood taking area. So we aim for the entire process to be executed without stigma and discrimination, thereby bringing the standard to 100%. This is our indicator and standards. Indicator is percentage of S&D among healthcare workers towards PLHIV during blood taking in KK Pontian. The formula is the number of healthcare workers with S&D towards PLHIV during blood taking divided with total number of healthcare workers involved in the blood taking procedure times with 100. Our period of study is between October and November 2021, and our standards is 0% stigma. Coming on to the process of gathering information, we are using a quasi-experimental study design, uncontrolled before and after. We use non-probability convenience sampling technique with a sample size of 46, and we utilized tools such as questionnaire, related audit monitoring form, and interview protocol. And our study period is October to November 2021. So for our verification phase, we started in 1st October 2021 for 2 weeks, followed by remedial action for 4 weeks, and concluded with post-remedial action for 2 weeks that ended on 30th of November 2021. So this is the inclusion and exclusion criteria. For the inclusion criteria, healthcare workers in KK Pontian who are involved in HIV patients during blood-taking procedure, while the exclusion criteria is healthcare workers who are not working in KK Pontian, healthcare workers who are not involved in managing HIV patients during blood taking, and healthcare workers who are transferred out during study period. This is our specific breakdown of our plan for data collection at the 3 specific locations, which are the triage, the registration counter, and the procedure room. We are using a simple audit form to monitor stigma and discrimination involved in each process of care for each staff involved. Coming on to analysis and interpretation. So, for our verification phase, we have narrowed down our sample size to 46, which consists of only the staff that are involved in blood-taking procedure. So we found out that 93.5% of healthcare workers in KK Pontian is having fear and stigma during blood taking. To identify and understand healthcare workers' perspective towards S&D, we are using thematic analysis via NVivo 12 Plus apps, in which we employ interview protocol questions. We formulated open-ended questions to 5 participants. So this is the breakdown of how thematic analysis is carried out to find out the causes of S&D among healthcare workers. Basically, the repetitive words in the interview transcripts are put in this coding table, and then the most repetitive words will be grouped into categories, and then the categories will finally will form the main themes. This is the final outcome from our thematic analysis, and we found out that 3 main factors has caused S&D to PLHIV during blood taking, which are poor knowledge and awareness, improper practice among staff, and ineffective SOP and protocol. So, in the verification phase, we can see here almost all staff carried out the first 2 processes of care within or nearly 100%. However, at the final process of care, we can see that only 30% of them fulfill the criteria for putting on single gloves and avoiding unnecessary preventive actions. So, we have employed 8 strategies for change. The first one is by training and education, awareness promotion, and eliminating the usage of biohazard label. For the second problem, we aim to collaborate with NGO, and then we aim to get input from PLHIV by means of blood box. For the last problem, which is lack of information in the facility, we have planned to develop S&D digital reminder and sharing HIV-related S&D via the KK TV and projector system, and creating protocol corner in the procedure room. So this is the details for our strategy number 1. Our team leader has created a concise digital training module that serves as a quick reference to the healthcare worker. We gave a pre- and post-test questions consisting of 13 questions to gauge how this module affects stigma and discrimination knowledge amongst the staff. So we found out that after giving the module, the S&D knowledge among staff has dramatically improved to more than 90% as compared to about 40% previously. And for those who have difficulties assessing the training module, we have given them targeted small group training. We also give this training to the healthcare workers who had poor knowledge of S&D. For our second strategy, which is awareness promotion activities, we created awareness via promotional activities such as making TikTok video and creating poster competition that centers around ending stigma and discrimination towards PLHIV. We also have shared S&D related materials in our official KK Pontian Facebook, mainly the do's and don'ts video and our End Stigma TikTok video. We have also made World AIDS Day as an annual event in our KK to increase awareness among the healthcare workers and public. This is the pictures taken from our very recent World HIV Day in KK Pontian, in which we created a giant HIV-themed mural on the wall. We also made HIV-themed face masks to be distributed to all the staff. And we also display the winners of the poster competition. We also have circulated a letter digitally to our KK staff, signed by our FMS, mentioning on the brief introduction on World AIDS Day celebration theme, which is ending stigma, and then advising on appropriate measures upon attending PLHIV and key population in the facility, and emphasizing on the need to upgrade self-knowledge and awareness related to HIV S&D. Our third strategy is collaborating with NGO and AADK. Actually, this has been started since March this year, while the most recent one being last month on the 4th November, in which we offered free HIV and Hep C rapid testing to 52 key population in AADK. And this has yielded 1 new HIV case and 7 Hep C reactive cases. We also offered pre- and post-test counseling. We also collaborated with Intern Life Zone to reach out key population in the district on a regular basis by providing anonymous screen tests and offering private hotline contact number for consultation anytime, anywhere. We have also assigned a dedicated liaison officer for them to easily contact us. For our fourth strategy, we also had S&D digital reminder broadcasted to our KK WhatsApp group and our HIV Telegram channel weekly basis. We also shared S&D related materials, mainly the video of do's and don'ts, via the facility TV and projector system daily to educate the public on correct information related to HIV and to instill positive outlook among the healthcare worker towards PLHIV and to create welcoming environment to PLHIV and key population. We also have created a protocol corner in the procedure room. It is simple, straightforward, and visual. This is also to give reassurance to staff in case of sharp injury occur. There is proper manual on sharp injury and subsequent management involved. For strategy number 7, we also have eliminated physical labeling against PLHIV in the facility. So for our last strategy is we created a We Hear You box as a platform for PLHIV to give opinion, suggestion, and complaint for better improvement in the facility. This box is placed in the consultation room and the methadone room. So the effect of changes. We can see after the interventions, we can see there is significant improved stigma from 93.5% of the healthcare workers having stigma during blood taking, decreasing to only 2% of them still having stigma. We can also see at the cycle 1 of our model of good care, post-remedial, that the entire process has achieved 100% standards as opposed to only 30% standard as before in this single glove criteria and avoiding unnecessary preventive actions criteria. thereby making all the entire process of blood taking done without stigma and discrimination into 100% standard. As we can see here in this chart, our ABNA, our achievable benefit not achieved, has also reduced from 93.5% to only 2%. So the impact of the project. The first one is we aim to increase knowledge and awareness towards HIV-related S&D among healthcare workers and the implication of S&D to the PL-HIV treatment and care. We aim to instill welcoming and safe environment to PL-HIV and key population. Therefore, we'll increase treatment access to them. And we also aim to nurture positive attitudes among the healthcare workers towards PL-HIV. Besides reducing stigma towards PL-HIV during blood taking, we can also see significant improvement for all other domains. Post-remedial, which is avoiding physical contact, has reduced to 0%. Wearing double gloves has reduced to only 2%. And by domain of S&D awareness, have recorded more than 50% decrease from the pre-remedial. We can also see that the level of stigma among healthcare workers by domain of attitudes towards women with HIV shouldn't get pregnant has decreased from 54% to only 2% post-remedial. Post-remedial survey conducted among PL-HIV in KK Pontian also demonstrated a positive impact in a sense that 0% mentioned that they were treated without respect during clinic visit. 0% mentioned that there is no privacy and confidentiality observed during clinic visit, while only 10% mentioned that they are not involved in decision making about care and treatment, as opposed to pre-remedial. So this is the preparation and material for our study. This is the pictures of the team, multiple meetings and endless meetings, pictures of a video editing process, and the video of World AIDS Day preparation, preparing the HIV-themed masks and the mural, and creating the HIV corner during HIV Day. So, the challenges that we faced is few healthcare workers still has the misconception on the modes of HIV transmission despite CME given, and few of them has this rigid belief and values that render discriminatory behavior towards key population despite being taught CME. There is also lack of awareness related to stigma and discrimination towards key population in social and mainstream media. And then the results of the study is relied on self-reported basis and is therefore subject to reporting bias. The lessons learned from this study is HIV-related stigma still exists across all types of healthcare workers. Continuous CME on HIV-related stigma must be given to healthcare workers to ensure knowledge of HIV disease and its transmission is always up to date among staff. Consistent reminder on HIV-related S&D must be given from time to time, as the staff tend to forget after a while and may redevelop stigma again. And then campaign effort on elimination of HIV stigma and discrimination in KK Pontian by posters, reminders and audits are important to make sure our effort is sustainable. And lastly, the existence of policies alone may not be effective enough to reduce HIV-related stigma unless there is enforcement of the policies. So for our future plan, we aim for 95%, 95%, and 95% in treatment cascades by 2030 towards PL-HIV. In order to achieve this target, we have to make CME on HIV-related stigma, and discrimination to all healthcare workers compulsory every year. And then we have to assess the staff understanding and behavior towards HIV S&D on a regular basis. We also have to do more collaboration with Intern Life Zone to do outreach program involving the key population to promote infectious disease screening and provide peer counseling through hotline. And lastly, we also have to do regular audit in the facility. This is our Gantt chart for the study. And these are our references for the study. With that, we thank you.